then began speaking gibberish. Video of Serene Branson reporting after the Grammys quickly went viral. Some thought it was funny. We've later learned, as Andrea Canning's going to tell us, this is now a medical mystery and one that's very serious.
Well, a very, very heavy debatation tonight. We had a very Darrison bite. Let's go to Terry's and look for the head of the pit.
It's almost painful to watch. At first, Serene Branson seems impaired or nervous, but take another look.
We had a very Darrison bite. Let's go to Terry's and look for the head of the pit.
Online, some are speculating it could be a medical issue. Miss Branson needs an MRI. Stroke on air? We showed the video to neurologist Jesse Weinberger.
Is it possible she's having a stroke?
Well, she's definitely having difficulty expressing her words, which neurologists call aphasia. That's a symptom which can be related to a stroke, but it could also be other things like a partial seizure.
That's exactly what happened to Wisconsin anchor Sarah Carlson last month when she had an epileptic seizure on the air.
Saw unto Sracho and Play Springrick by Health or Assist.
There was a huge part of my brain that knew it was happening and thought, I wonder if I'm saying anything that makes any sense. And finally, after probably 10 or 15 seconds, I give up and look down, realizing I probably wasn't making sense.
Carlson says she almost saw herself in Serene Branson's video.
I thought it was eerily similar. The look in her eyes, even, that I can recognize, and the way she spoke. They weren't real words, but she tried so hard to keep something coming out of her mouth.
Late Monday, Branson's local Los Angeles station updated viewers on her condition.
She wants us to know she followed up with a visit to the doctor for some medical tests. Serene thanks everybody for their concern and good wishes and hopes to be back on the air very soon.
We had a very Darrison.
And that was Andrea Canning reporting. Now, initially, Branson was seen by paramedics at the scene right after that incident and was later driven home by a colleague. But it does look like she has undergone further treatment. Now, for more on this, let's toss things over to Megan.
All right, thanks, Charlie. Well, doctors have been looking at this video over and over, trying to figure out what happened the other night with that reporter. We've heard stroke. It's maybe a possibility, so we asked our doctor, Dr. Arbaje, to take a look at it. Thanks for coming in.
Thank you for having me.
So when you watch that, it's tough to watch. Does it look like to you somebody stumbling over their words or perhaps something more?
Yeah, it certainly does look like something more. So, you know, she's definitely not someone I've ever seen before. I just saw the video that you just described, so she's not a personal patient of mine. But just looking at what you showed, it does look like something more might be going on. And usually we think of a couple of things. So stroke or a mini stroke, which is sometimes called a transient ischemic attack, but also a seizure could also cause this type of activity. Really, all we know is that she had trouble speaking, but in a way that might signal that something might be going on in the brain.
We have heard stroke from a number of people who have looked at this. She seems young to have a stroke.
She sure does, and usually it's older people that end up with strokes, people who have had long-standing high blood pressure, who smoke, people who have had cholesterol problems. So she's certainly not in the age group to be having that, although it certainly could be a possibility. But most likely what will happen is that she'll get some imaging done of her brain to figure out, you know, whether it's a CAT scan or an MRI, and surely she'll be seen by a neurologist to help figure out what it was that caused her to have this transient moment of not being able to get her words out right.
A seizure, a stroke, any sort of medical issue is tough enough for somebody to go through, even more so when all of a sudden it's done on the air, and your own personal medical problem has now become everybody's.
It has become everybody's, and we like to keep our medical situations private because certainly stressful situations can bring out medical issues, and certainly being on the air can be a stressful situation that may have, you know, been something that has contributed, but I agree this is something that is very difficult to kind of have in the public sphere, so we hope that she really does get the care that she needs.
Well, thank you for taking a look at it and giving us your medical opinion, and of course you're going to stick around and talk about heart health with elderly patients.
That's right.
So we appreciate that. And just so you know, for those of you at home who are curious about this, we'll stay on top of the story. We're actually going to have a neurologist come in tomorrow. So stick with that. And Charlie, I'll send it over to you.
All right.